Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay, as you've probably already heard, that Justin Trudeau has ordered that the barricades must come down, and he's claiming that of course, that lines of talk are open, that the hereditary chiefs are able to the doors are open to dialogue about what the problems are, about and what needs to happen to make things go the right way. And he's also saying that, of course, while he's ordering that the barricades need to come down, and that he does claim to have a dialogue with one of the Wet'suwet'en chiefs about what's going on and how to come to a resolution. So let's listen to that, and we'll be right back with more comments.
Canadians have been patient. Our government has been patient. But it has been 2 weeks, and the barricades need to come down now. I want to assure Canadians that we are engaging at all levels to resolve this quickly and mitigate the very real impacts of these blockades on people. When I addressed the House of Commons on Tuesday, I sent a clear message to the Wet'suwet'en and Mohawk nations, as well as Indigenous leaders across the country. I said that our government is listening. I reiterated our commitment to a peaceful resolution. I expressed our desire to work in partnership with all parties concerned. That was 4 days ago. In the time since, our government has kept engaging at all levels. We repeated our calls for collaboration. We showed respect. And, in parallel, the RCMP is standing down their command post at the 29-kilometre mark along the Morris West Forest Service Road, one of the specific demands of the Wet'suwet'en. But Canadians who are feeling the very real impact of these blockades are running out of patience. Every attempt at dialogue has been made, but discussions have not been productive. We can't have dialogue when only one party is coming to the table. For this reason, we have no choice but to stop making the same overtures. Of course, we will never close the door on dialogue, and our hand remains extended should someone want to reach for it. In fact, Ministers Miller and Bennett just got off a call with the Wet'suwet'en hereditary chief just minutes ago. But the fact remains. The barricades must now come down. The injunctions must be obeyed, and the law must be upheld.
And remember that Justin Trudeau said that we're a country who follows the order of law, and that the government, as politicians, are not going to get in the way of the operation of the RCMP, and that we all need to follow the order of law, and thus meaning that everybody should follow the court injunctions and do things using the court system if the court system is actually listening.
Good evening, Prime Minister. David Aiken, Global News. Last night as you got off the plane here in Munich, you said we're a country of the rule of law and we need to make sure those laws are followed. And I know a lot of Canadians took note of that, but we're looking for the follow-up, which is how specifically, what specific steps will you and your government take to make sure that those laws are indeed followed?
First of all, obviously we are not the kind of country where politicians get to tell the police what to do in operational matters. We have professional police forces right across the country who are engaged in this issue as their mandates lead them to. But let us remind ourselves that this has been a really difficult week for Canadians. People having trouble getting to work, to school, or home. Small businesses having trouble getting their goods to market. Institutions like hospitals worried about resupply in ways that can really impact Canadians. We are a country that recognizes the right to protest, but we are a country of the rule of law, and we will ensure that everything is done to resolve this through dialogue and constructive outcomes. Je reconnais d'abord que ça a été une semaine extrêmement difficile pour beaucoup de Canadiens. De la difficulté à se rendre au travail, à la maison, à l'école. La difficulté pour les entreprises à envoyer leurs marchandises vers leurs clients. Des institutions comme des hôpitaux inquiets du ravitaillement de biens essentiels pour servir les citoyens. Il y a énormément de gens qui sont très inquiets. Et je rappelle qu'on est un État de droit. On reconnaît le droit de manifester, mais ça doit être fait dans la règle de droit, suivant les lois, suivant la Cour. Et on n'est pas un pays où les politiciens peuvent ordonner à la police de faire quelque chose d'opérationnel. On est un pays qui a confiance que les policiers vont pouvoir faire leur travail.
The scope of these blockades, the disruption to our transportation system, have provoked a national crisis which few prime ministers have faced. And yet, here you are, out of the country, with plans to be out of the country next week again. Do you still think it's a good idea to be going to Barbados next week if the situation is not resolved?
First of all, as you know, we have been fully engaged, fully seized with this as a government. I myself have been on direct phone calls with premiers like Premier Horgan and with my team. Our Deputy Prime Minister has met and connected with all her provincial and territorial counterparts, all the premiers, the ministers of transport, of Indigenous affairs and Indigenous services are fully seized with this issue, and we are working on it with a whole-of-government approach that is totally focused on resolving this situation the right way. Canadians are worried, and we will stay engaged on this issue.
We have some other clips along with this, kind of tempering what the overall atmosphere of what's going on with government and, of course, the hereditary chiefs. And everybody's kind of standing in solidarity. There's been some other news releases out there that are saying that the First Nations and Indigenous people are fractured. That you have some that are saying that no, we need to go forward with the pipeline, and others are saying that we shouldn't do the pipelines, and by it going from the West Coast to the East Coast with everybody under the same flag of solidarity, I'm thinking that maybe there isn't so much fracturing as maybe some of the more mass media sponsors want released.
I believe it's time for the law to be enforced. Law enforcement should enforce the law. We have court orders, we have court injunctions, they need to be respected. Okay, these protesters, these activists may have the luxury of spending days at a time on a blockade, but they need to check their privilege.
I think those are not helpful comments in this context. This is a complex situation, and I think that that does not indicate an understanding of the situation.
Absolutely. We are going to act within our authority, and I know there's some communication from the Leader of the Opposition in terms of suggesting that the Prime Minister can pick up the phone and order the RCMP, or the Premier of Ontario could order the OPP to break down the barricades, but that's not something that we can do. We're a country that abides by the rule of law. And in terms of, we will do what we can in the meantime, and that's keeping the lines of dialogue open, communicating with the protesters that are engaged in protest, calling upon them to abide by the law of the land, but in the meantime, we're going to do what we can, and I know Ministers Miller, Bennett, are working very hard, and Minister Garneau working very hard to ensure a peaceful resolution to this crisis.
Right. And the First Nations and Indigenous peoples are actually standing as one. Those who truly speak for the different groups are actually talking for the people who want the blockades really are representing the people, and the appointed chiefs maybe are only speaking for the corporations. So that's yet to be seen. More opinion than anything else, but I don't think that the Indigenous people, are actually fractured. I'm thinking that they're standing in full solidarity with each other. So, so much for mass media and more looking at what's really going on. So, there we have it. Okay, so next up, we're going to be talking about, of course, the coronavirus and the effects in how the World Health Organization is actually working very diligently to stop a global pandemic with this virus. I am going to caution everybody listening to this. Look, if you're trying to find out information on what you can do personally to protect yourself against this particular virus, I'm going to caution you not to just Google something from off of social media. There's a lot of misinformation going around stating that there are erroneous ways that of catching this virus. If you want to find out how to protect yourself, if you could be in danger of being exposed to it, go to the World Health website. Do not look for any other information outside of the World Health website on how to protect yourself. The clips that I'm going to play for you are actually from the World Health Organization. It is their own releases. It is that I actually collect from off of their Twitter account and their YouTube. I do not collect information about this particular thing outside of the World Health Organization because they're the experts. They're the ones that are actually actively battling against the pandemic that could happen. They're the ones to actually look to for all information and how we can actually help the World Health Organization deal with this particular virus. I will caution you also that if you're probably listening to this from within the U.S. or Canadian borders, you're probably not in that much danger unless you know somebody just traveled to Asia and back again. And more specifically in the specific regions of China where this all kind of started. If you otherwise, it's like you're not going to be in danger. So, and that is also coming from, of course, information that I have gathered from the World Health Organization. Okay, so listen to this next little bit about is different questions that other press members have been able to ask of the World Health Organization about what's going on as to date. Okay, so here we go.
Today we have Dr. Tedros, the Director General. We have Dr. Jawad Mahjour, who is Assistant Director General for Emergency Preparedness, and Dr. Sylvie Briand, Director of Global Infectious Hazard Preparedness here at WHO. As always, we will have audio file available immediately after the press briefing, and transcript hopefully will be posted tomorrow morning. I hope you all know where to find those briefing materials. So I'll give the floor immediately to Dr. Tedros for opening remarks.
Thank you, Tariq. And good afternoon, everyone. Let me start, as always, with the latest numbers. As of 6 a.m. Geneva time this morning, China has reported a total of 75,567 cases of COVID-19 to WHO, including 2,239 deaths. In the past 24 hours, China has reported 892 new confirmed cases and 118 deaths. The significant decline in new confirmed cases is partly due to another change in the way China reports numbers. As you know, last week, China started reporting clinically diagnosed cases in addition to laboratory confirmed cases. They have now switched back to reporting only suspected and lab confirmed cases. This may indicate because the health system in Wuhan have regained the ability to test all suspected cases. As a result, some cases that had been clinically confirmed have now been subtracted from the total because they have tested negative. Although the number of cases in Hubei province continues declining, we're concerned about an increase in the number of cases in Shandong province, and we're seeking more information about that. Outside China, there are now 1,152 cases in 26 countries and 8 deaths. Although the total number of cases outside China remains relatively small, we're concerned about the number of cases with no clear epidemiological link, such as travel history to China or contact with a confirmed case. Apart from the Diamond Princess cruise ship, the Republic of Korea now has the most cases outside China. And we're working closely with the government to fully understand the transmission dynamics that led to this increase. We're also concerned about the increase in cases in the Islamic Republic of Iran, where there are now 18 cases and 4 deaths in just the past 2 days. WHO has supplied testing kits and will continue to provide further support. Our concern continues to be the potential for COVID-19 to spread in countries with weaker health systems. Tomorrow, I will address an emergency meeting of African health ministers held jointly by the African Union and the African Centers for Disease Control and Prevention. Meanwhile, the WHO-led joint mission in China has been working in Beijing, Sichuan, and Guangdong, and will travel to Wuhan tomorrow to continue its work at the epicenter of the outbreak. We're working with all of partners under GORN to safeguard the health of the members of the team and to take appropriate measures when they return to their countries of origin. I'm also pleased to announce today that we are appointing 6 special envoys on coronavirus, on COVID-19, to provide strategic advice and high-level political advocacy and engagement in different parts of the world. I'm pleased that the following eminent individuals have accepted my invitation to act in this role. Professor Dr. Maha El-Rabat, former Minister of Health of Egypt; Dr. David Nabarro, former Special Advisor to the UN Secretary General on the 2030 Agenda for Sustainable Development goals and climate change. Dr. John Kengasong, Director of the African Centers for Disease Control and Prevention. Dr. Mirta Roses, former Director of the WHO region of the Americas. And Dr. Xin Yang Su, former Regional Director of the WHO region of the Western Pacific. And Professor Samba Sow, Director General, Center for Vaccine Development in Mali. As I said yesterday, WHO's key role is coordinating the global response to the epidemic, and our new special envoys will help us to do that. This is another step we're taking to take advantage of the window of opportunity we have to contain this outbreak. Once again, the measures China and other countries have taken have given us a fighting chance of containing the spread of the virus. We call on all countries to continue their commitment for containment measures while preparing for community transmission if it occurs. We must not look back and regret that we failed to take advantage of the window of opportunity that we have now. I thank you.
Thank you very much, Dr. Tedros. Before taking questions first from the floor then online, just to remind everyone dialing in that it's *9, and those watching us online, it's clicking raise hand on the computer. So we'll start questions from the room. Musa first, please. If you can just introduce the outlet you're working for.
Musa Asi, Al Mali News Channel based in Beirut. Ma question en français, s'il vous plaît, concernant... Si ça marche. Oui. D'accord. Donc ma question concerne l'Iran et le Liban. Le Liban aujourd'hui, on a annoncé à Beyrouth qu'il y a un cas en provenance de l'Iran. Est-ce que ces deux pays ont le moyen de faire face à ces virus, et quel rôle le WHO peut jouer ou assister ces deux pays à faire face? Est-ce que vous avez des contacts avec ces deux pays pour organiser quelque chose? Merci.
Thank you very much. Questions about Iran and Lebanon that have announced cases. Do these countries have a health system strong enough to deal with this, and how WHO can help them?
Non, merci beaucoup pour votre question. Oui, ils ont les capacités de base pour détecter ce type de virus, mais nous sommes en train de discuter avec les deux pays quelles sont les possibilités de coopération et aussi quels sont leurs besoins en assistance technique. La preuve, c'est que le cas du Liban, il a été détecté à l'aéroport. Donc les autorités libanaises ont mis en place un système qui cherche les cas symptomatiques dans les vols provenant d'Iran et qui leur propose le diagnostic et le traitement. Donc c'est comme ça que ce cas a été détecté. Ça prouve jusqu'à un certain point que la capacité existe. La même chose en Iran, et le bureau régional de la Méditerranée orientale est en train de travailler avec eux pour pouvoir un peu évaluer la situation et aussi voir quels sont les besoins en assistance technique de notre part, et nous sommes en contact permanent avec eux.
Can we do a shorter English version, please?
No, I think the two countries, they have the basic capacity to detect this kind of viruses, and the case in Lebanon was detected in the airport because they were screening the symptomatic cases coming from Iran, and this is how this case was detected. And the original office in Cairo is now in contact with the two countries to assess the situation first and to try to evaluate what is the kind of technical assistance that these two countries may need, and we are ready to provide this technical assistance.
Thank you very much, Dr. Mahjour. Yes, please, and then our Japanese colleague, and then we will move online a little bit. Yes, please. If you can just press.
Yang with Xinhua News Agency. You mentioned that the international experts group will go to Wuhan tomorrow. So is there any specific steps they're going to conduct in Wuhan?
Yeah, as I said it a couple of times ago, the expert group is fully empowered to suggest and also operate based on the situation on the ground. So that's up to them on what to focus and also the next steps they want in Wuhan. Thank you.
Thank you, Dr. Tedros. Yes, please.
Hello, good afternoon. I am Rintalo from Nikkei Japan Media. You pointed out in South Korea and in Japan, in Singapore, it is indeed a fact that the COVID-19 has spread rapidly in recent days, although the fatality rate is still low. Even in this situation, do you say that you have not yet observed and clear community transmission outside China? Thank you.
Yes, thank you for your question. Indeed, we are looking at the numbers and also working very closely with those countries to try to understand and to give meaning to those numbers. As you know, we have seen in previous outbreak of SARS and MERS-CoV what we call super spreading events. So in those kind of events or situations, we may have a rapid increase in numbers, but as long as we can understand how the transmission has occurred and how the new cases are linked to this event, then we can also make sure that we can stop the transmission. And so this is the kind of investigation that all countries are doing currently, trying to differentiate, is this a low-level community transmission that were undetected, or do we face this kind of super spreading event where more cases are infected than we see usually with just person-to-person transmission. And so we are monitoring the situation very closely. In South Korea, they are still very committed to stop transmission, and so, but at the same time taking the right measure to contain if we have a super spreading event.
Thank you very much. We will now go to some journalists online. We will start with Mr. Banjo Kaur from India, calling from Down to Earth. Mr. Kaur, can you hear us?
Yeah, I can hear you. Can you hear me?
Yes.
Okay, so my question is to Dr. Tedros. You said in your opening remarks that China changed the strategy again because their investigative or their surveillance methods have improved. But they started with lab-confirmed cases, then they went to clinical diagnosed cases too, when the numbers spiked for about 15,000 in a day. And now they have gone back to lab-confirmed cases. So don't you think that this, seesaw has created some sort of epidemiological confusion, not just among researchers, but also among journalists and people at large? My second question is regarding the Diamond Cruise ship. Though passengers have started disembarking now, but do you think in hindsight that quarantine of so many people on a ship was a right strategy and it did not go wrong, especially for those people who were on board? Thank you.
Thank you very much, Ms. Kaur, and my apologies for not recognizing that it's a female name. So 2 questions.
Okay. Would you like to start the first one?
So I think on the epidemiological situation in Wuhan, as we said earlier, and we observe in other epidemics, it's not unusual to count things in a different ways as the epidemic evolves, because as Dr. Tedros said, it's also related to the capacity to have laboratory diagnostics. And so what is really important in epidemiology when you observe an epidemic is to remember that surveillance or monitoring of the disease aims at taking the best possible decision. And so it's really numbers for action and not numbers for numbers. And so as long as we understand how things are counted and what the numbers include, then it helps us to make the best possible decision to protect the health of the people. And so this is why we are in constant discussion with Chinese authorities to understand how things are counted, which basis, and beyond the number, what is really important is the trends, but also the intervention that can be taken to really down or curve down the epidemiology curve. So this is why we are focusing on more understanding their definition rather than really looking at the numbers, because at the end of the day, a small difference in numbers, if it's a good decision behind it, is probably what matters most.
No, for the action taken by in the Diamond Princess cruise ship, I think usually when health authority take any decision, they take it based on the local context first, based on crew risk assessment and crew risk management, and take the decision. And it's very difficult in the middle of the action to look to how this to some extent these measures were or not helpful. But what we recommend to all countries is after the event to do an after action review exercise where all the people who were involved in this, including WHO and others, to assess the measures taken, to take the lesson learned, and to come up with the solution for the future event.
Okay, thank you. Maybe I will add to that. To the first one, I fully agree with what Sylvie said. Then in addition to that, better approach would be to have the confirmed lab cases and suspected cases. We do that for Ebola too, by the way. Until they're confirmed with lab testing, we keep them as suspected, and once they're lab confirmed, then they're taken as confirmed cases. So China has moved into this kind of method, which is in our analysis or in our case better actually, because if you call the clinically confirmed cases as confirmed, when you test it in a lab, the clinically confirmed cases could turn out to be negative. So that's why in a place where we have laboratory capacity, the recommended approach is to have the lab confirmed cases from the suspected cases. So you have the lab confirmed, and then those who are not confirmed yet, the suspected cases. That really brings clarity in the approach, and we're glad that China has come back to that kind of counting, and this will bring clarity actually, and I hope, as you have asked, Namaste by the way, this approach will bring clarity. Then on disembarking, I agree with what George said, and one thing I would like to add is our advice to Japan and other member states was any action they take, it should be proportional to the public health risk they see. And they have already deployed their experts, and they told us that the measures they have taken is proportional to the public health risk they have seen. So we take that, but as Joe had said, there could be something that we can learn from, especially when we do the after action review for the future. Thank you.
And thank you for listening today. Join us next time on Policy and Rights, where we try to cover what is important as far as government policy versus our rights. show has been produced by Depictions Media. Please contact us at depictions.media for more information.